Good morning, Dave. Good morning, everybody. Glad to be with you today.
Well, you've got a little story to share with us today.
Yeah, as we were talking before we came on air, this process of learning and growing as a practitioner, there's always things to learn. There's always things to help folks get on the healing path and to develop a journey that's the most optimal for them. But sometimes it comes down to physicians like myself. If we're not looking to continue to always expand that toolbox, so to speak, we can kind of get in patterns where maybe we're not utilizing all of the best things to help folks get on that path.
So you had a patient that was struggling and had done a little bit of research, and you had done a little bit of research, and you've had some success.
Yes. So this individual, he was very much in the hospital on a regular basis, and with infections of his legs. And these leg infections were called bacterial infections, cellulitis. And he kept going in and getting IV antibiotics and fluids, and it was just, and of course we've talked a lot about antibiotics. They're great when we need them, but they really wipe out the good bacteria in our microbiome, in our digestive tract, which help our immune system and all the other things. So really don't want to have to rely on the antibiotics very often if we don't have to. So he was on the road with his job and listening to different approaches to help prevent infection of the skin and cellulitis. And he came across iodine. And I tell you what, iodine is fast becoming something that I've been utilizing more and more in our practice here and my recommendations. And he got going on the iodine, and all of a sudden, he stopped having cellulitis, infections in his skin. And I can't tell you over the years, how many folks, if I would have known that little trick, how many folks I would have been able to help with this recurrent cellulitis. So iodine is another example. So iodine, it's a mineral that comes in different forms, iodide and iodine, and it is essential for our body's hormone-making capacity. It's huge for thyroid. It's huge for all the other hormones in the body. In fact, when we talk about free T3 and free T4, which is a thyroid hormone, the 4 in there means 4 iodines. Free T3 means 3 iodines. And so when your body is trying to make thyroid hormone, if it doesn't have enough iodine, the body's ability to make that thyroid, what it does is it goes through all the rest of its resources, its iodine resources. And so we can end up in a position where our body is absolutely starved. Just like many, many, many things, our body, we find is starved of a lot of nutrients and minerals, a lot of vitamins, so on and so forth. And that's the case with iodine. And so when it comes to thyroid, for instance, in management of thyroid, there's a gentleman called Dr. Brownstein, a friend of mine out of Michigan, and that's become a foundational piece of his practice over the last 20 to 30 years. And the results he has seen with that, and it's pretty incredible. So, for instance, many times what we're going to do is measure an iodine level on folks. In fact, it's a urine loading test that we can do, and it's a 24-hour test. And in the cases with him in his practice, Dr. Ng, they found about well over 90% of their patients were deficient in iodine. And so one other interesting correlation then is they found out that folks that are deficient in it tend to produce or be greater at risk for cancers, greater at risk for even fibrocystic breasts, which afflict many women, many times ovarian cysts even. I can't tell you all the times over the years that I've worked with women that have the fibrocystic tender breast and ovarian cysts, and potentially this little trick with iodine, they were potentially deficient in iodine. And so there are so many applications of it that even from an antimicrobial perspective, like we talked about with this gentleman's legs and recurrent cellulitis of the legs, but it actually can increase apoptosis, which is cell death in cancer cells at higher doses. So it is another one of those what we call non-standard of care off-label things to consider for not only cancer prevention but cancer treatment. And so super, just absolutely blew my mind the more and more I learn about iodine and hear stories of folks that have kind of gone out on their own little journeys to help fix themselves when nobody else was able to figure it out. And this gentleman was able to do it. He was so excited because he had worked with Dr. Brownstein, listened to some of his stuff, and then he found that we were through the Integrative Medicine, that we were on a website with Dr. Brownstein utilizing ozone. So he actually found us because he was researching Dr. Brownstein, and he has implemented, his whole story has been an incredible story, is way beyond iodine, and I did tell him I hope to get him on in the clinic, because every week he comes in, we've been utilizing IV ozone, injections of ozone, and he's getting to the point where he's getting mobility back, and so the combination of him already working on iodine therapy, iodine repletion, optimal thyroid health, which is huge for the body's ability to make energy or ATP. Then you throw on the miracle molecule of ozone, and he is absolutely seeing some incredible results. But iodine, Dave, just another example of one of the many things that it still floors me that all the years, now part of my practice is folks that are low in thyroid. Immediately, for all these folks, I'm thinking iodine, and in some cases, we want to get those iodine stores completely replete before we start them on thyroid hormone. And in some cases, even they might not even need to go on thyroid hormone replacement if we get their iodine stores back to normal.
So walk me through this FT4 again. We see this in our lab results. Walk me through that again. And
so the FT4 is produced in the thyroid, which is in the neck, and that is then converted. That's got 4 iodine molecules in it, and that is then converted to free T3, which has 3 iodine molecules in it. And so what's interesting, there is different forms of iodine, and so it's pretty important. The research has shown that the best results are with iodine and iodide. The other interesting thing, Dave, is that over the years, why have we become so deficient in it? And of course, we all remember the iodized salt that we had on the table growing up that was supposed to help fix people that were getting these big masses on their necks called goiters. And it did a pretty good job of fixing the goiters, the iodized salt, but it still, in many cases, was not enough to provide prevention for all these other areas to support thyroid, overall thyroid health, prevention of cancer, fibrocystic breast, ovarian cysts, and on and on and on. And that iodized salt is probably not the healthiest thing for us in the first place. They've taken all the minerals out of it, and there's a process that they do that gives it that white color that makes it maybe not the best choice. So when we're looking for a salt, whether it's Celtic salt, something that's got some natural iodine in it, plus the minerals still in it, that's optimal. But we can always do something like Lugol's iodine, Dr. Lugol. He was the guy that really started to develop and understand the importance of iodine in our health. And then we've got tablets that we utilize that's got both potassium iodide and iodine in it, the combination. And that's what Dr. Brownstein shared with me, that he has found that the combination together is really, really necessary to move the ball on a lot of these chronic conditions and getting folks' metabolism back in order, thyroid back to functioning well. But other interesting things about, again, why is it that our thyroid levels are so and our iodine levels are so low? It's the halogens. And so fluoride in the water actually competes with iodine, the iodine receptors. And so, and then the same thing, they added bromine to the bread. They used to have iodized bread, and then they added bromine to it, which is a halogen, and that also competes with iodine. So a lot of the food products, and then you get fluoride exposure everywhere now, and fluoride can, in many cases, be a neurotoxin. You start to look and say, ooh, all these things. There's no wonder that our iodine levels are down and our thyroid's not functioning, because we've got all these other things competing for the iodine at the iodine receptor sites. And then we've got we're not getting enough in our diet, in our foods, our soils, and a lot of iodine does come from the sea. You can get it in fish. It's in the seaweed and things like that. But over the years, less and less in our soil. So it's pretty critical to talk to your provider about getting on some iodine supplementation.
Pretty incredible, this gentleman's story, how he's in and out of the hospital a lot with leg infections, and does research. You do research on iodine, and something as simple as iodine supplementation can provide great relief. That's just amazing. It
is. I mean, it's something so simple and so easily done. And this is, I mean, boil it down to basics again. It's oxygen, hyperbaric ozone. It's reduce toxins, reduce the toxin load in the body. So it's the processed food. It's all the frankenfood and things that we take in our body that are stressing our body, that we're ingesting, putting on our body topically on our skins, like a lot of the sunblocks and the insect repellents, and on and on, our shampoos. All these things what we're putting on ourselves are toxin our body, and if we take away those things and drink lots of water, so we're moving our toxins out, bowel movements every day, lots and lots of water, and then you throw in something like there's something as simple as oxygen and iodine, and it can be an absolute game changer, folks, and a really simple remedy that supports health and balance that will, again, keep you out of the doctor's office.
Yeah, and that's what everybody's after. All right, got to run here. Dr. Meyer, if folks want to come see you, maybe they want to have one of those wellness calls with you, what's the best way to get a hold of you?
Yeah, absolutely. Give us a call at 712-339-6024 for a discovery call. Those are 15 minutes long and complimentary, and make sure that we're all on the same page and a good fit for the plan forward, because it's a journey together to work in this field of healing space. And we are at 3305 Berquist Avenue, just off Highway 71 in Spirit Lake. So we got a great team, and we're ready to help you getting to feel like your best. You deserve that, and every day we want that for you. We want your brain to be popping. We want you to be bursting with energy, and we want you to be in as little as pain as possible. So those are some of our basic goals. We want that day to be a great day.
Hey, now, just a heads up, I sent you a text. I've done a little research on my own here, ran across this. I just typed in iodine deficiency. And this sentence is crazy. We don't even hear about this. Iodine deficiency is a significant public health concern globally.
There you go.
There
you go. And there's some great information out there on it.
Crazy.
But like I said, you want to really, as we do the supplementation on it, even though most people are deficient on it, to maximize and get you on your best dosage.
Yeah.
We should do that lab testing. So give us a call if you want to get going on that lab testing. Check your iodine levels. We can do that as well here.
Very good, Dr. Meyer. Always a great pleasure. Wow, that's just amazing to me. Have a great day. We'll chat again soon.
Take care, everybody. Be well.
Thank you, Doctor. Dr. Bradley Meyer with us at the Okoboji Wellness Clinic. Find out more, okobojiwellnessclinic.com.